The Wi-Fi is a fantastic opportunity for us to expand our mission in education, research and clinical care. So all of our students and researchers can use the AG Roam network, so we were able to put that up. And then with the clinical care part of it, we've obviously been able to deploy laptops on wheels and mobile devices and medical equipment that's connected over the Wi-Fi.
So all our clinical care is delivered on carts, which uses the Wi-Fi technology, and it's revolutionised both clinical and patient experience.
Before we used to take blood pressure manually, which takes lots of time. So now we use the Wi-Fi because that makes everything easy for staff to take blood pressure and also to record all the observation in order as quickly as possible. So that's why it's great.
We've been able to show that by using bedside devices, we have been able to release 600 hours of nursing time from routine documentation. That time can be used in direct patient care that supports the patient outcome, but actually supports the nurse's well-being as well.
So in the last 12 months, we've been able to roll out clinical documentation and electronic prescribing to enhance our patient record.
So the use of Wi-Fi enabled and remote access into electronic patient records has revolutionised my clinical care. So on call, I'm on call not in the trust, I'm at home or mobile, and I can now access into the patient that I'm discussing with the relevant doctor in the trust directly.
The midwives would work out in the community, they would fill everything on paper, they would then come back in, they would then put it onto the system. What it means for our staff is that they save an hour per woman not having had to come back in and do that double entry. So that's been a huge thing for us antenatally. Postnatally, with each woman having around about 4 to 5 postnatal appointments, we're now not having to do that on paper, and we're able to put that straight into the system, which when they then discharge from our care, it then links back into their main medical record.
The great thing about Wi-Fi being available free in the hospital is that patients are able to still live their lives while they're here. So they can contact their family, they can be in contact with work, and they can entertain themselves as well. So I think they're able to continue with their life while they're here on our site.
I came in just after Christmas. My partner had been quite ill, so we came in. I spent 5 days here, no one chucked me out, so he wasn't particularly responsive at the time, and I spent most of the time on the Wi-Fi, and I was very grateful for it. It was really helpful for my partner as well. Once he got a bit better, he was able to use the Wi-Fi, and I think he found that a big comfort actually.
Now, as a paediatrician, I get out and about on the bike and do a lot of work in different community settings, so GP surgeries, might be linked up to children's centres or other community centres. And so the difficulty there is a lot of those places don't have Wi-Fi, they don't have access to the internet, and that really gets in the way of the stuff that we want to do. So whether that's about using Wi-Fi around information that's on the internet, or indeed linking up to patient care records and some of the work that's going on there. So the next step for this project for me would be to try and get Wi-Fi out into GP surgeries, into community centres and other places where healthcare is delivered.
Putting in a Wi-Fi service for patients was something we absolutely wanted to do, but we also knew the constraints that we were up against, which was there is absolutely no money available. So was it possible? And the consensus was no, but we were determined to try it anyway. We did manage to find a vendor that would give us a free Wi-Fi service, and that's both free to the trust and to the patients and staff, and that was WiFi SPARK. It had never been done before, so we were very proud of what we managed to achieve, and it's had a huge benefit to the trust and our patients.